Good morning. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, joined with you live, of course, in the Dolph Simons Family Studio by Hawkeye. We're back with you today for an exciting day. You look like you and I both look like we were sleepless in Kansas City last night. I wonder what that could have been about.
I think a lot of around the nation.
I think the whole country was waiting.
Not very good sleep last night.
No, hopefully it'll get better and things will stay calm because COVID is not calm. We know that as our numbers continue to rise, Hawk.
It's still here.
It is still here, and it's growing.
Our numbers have gone up, yeah.
We have our highest number yet.
Yep. 44 in the hospital of active infections. That's not just everybody in the hospital. That's active infections who've been admitted.
I heard that there's 4 in the ED, which pushes us to 48.
Okay.
That's our peak.
Yeah, and that's not good. Our numbers in the ICU continue to rise as well. 15, half of those are on the ventilator, 7 are on the ventilator. We do have 29 that are in that recovery period, so we have gotten some people home, which is good, but unfortunately there have been more admissions for acute infection. And in Hays, they have 18 inpatients, 17 active, and 1 in that recovery phase. So their numbers are still pretty high as well.
You know, we had our chief medical officer call this morning, and I think the city, we call it the Core 6, the hospitals that have always been on all of our calls, and I think our overall numbers growing up in the city as far as the number of patients in beds, and we're going to address that more toward the end of the week. But I think that this is a big, important point here in Kansas City, and it's something we need to take really, really seriously, especially as we look at things like Thanksgiving. We just finished Halloween. We won't know the effect of the gatherings at Halloween for probably 2 to 6 weeks down the road. But even without that, we're starting to see rises.
And anecdotally, I do know that there were gatherings, and there have been cases that have come out of there.
Already?
Yes.
Yeah. I've heard the exact same thing, and I've seen some of those gatherings when I was doing a bike ride with my wife on Saturday afternoon, and we went through some neighborhoods, and the kids were out around 5:30, and all of a sudden the adults were out, and a lot of them were masks.
And the shameful thing is when it's if it is the younger people, but it's those 2 to 3 infections down the line where it comes to those vulnerable populations, friends or loved ones who are in those vulnerable populations, and now we have the holidays coming up, and that is going to make for not very good holidays.
We're going to be talking about Thanksgiving in just a minute, but first let's see what questions are out there from reporters, Bob. Okay, not hearing any right now. So then I want to turn to our guest today. Kevin Novorr is our Vice President of Support Services, and we're going to talk turkey today. How about that? And professional tips. We're not going to talk election politics.
That's right.
Unless turkeys are Republicans and Democrats, but I don't think they are. I think they're just
differentiate that.
I think they're an independent party, and they really need to work on their platform because I'm not sure they've got the right platform out there. So we're going to talk about Thanksgiving dinner with our bubble. You know, you run one of the biggest restaurants in Kansas City based upon the number of guests. Your team last year did more than 1.7 million transactions in the hospital cafeteria. How many, and our, I think that includes our patients and stuff as well, but
that's just the retail side.
Just the retail side of the cafeteria. All right. How many people are you going to cook for this Thanksgiving? How does this compare to pre-COVID things? In fact, how do you think we could do Thanksgiving safely?
You know, I think it's hard to tell at this point what our census is going to be on Thanksgiving, but typically we serve about 1,600 Thanksgiving meals between lunch and dinner, so you can have your choice either way. So we serve a lot of turkey meals on Thanksgiving, and we expect to do probably a similar number this year. And actually this year we're going to do a Thanksgiving dinner on Thanksgiving Day and the day after Thanksgiving. So
that's a lot.
It'll be a little bit more. It is a lot. It's a lot of turkey.
And I've already done the first, so I'm really sleep deprived today. I called Kevin Jeff. I've only known him for like 5 years.
I know.
So my first apologies.
I know.
There you go. So am I. All right. So we have a couple of slides to walk through, I think, to help acquaint us people. And, you know, you've heard Dana and I say forever, stay within your bubble, watch your bubble. Those are the people you're safest around, and make sure you take care of each other and take all the right infection control things as best you can. And we've talked about how not trying to have really large gatherings, because when especially if you have big gatherings, you bring in a lot of people, and that's when COVID gets exchanged. And we said, remember, COVID is not forever. So people look at this and it's like, oh my gosh, we'll never have another Thanksgiving. Yes, we will. And the odds of us having a much better Thanksgiving as far as COVID next year are really, really good. Like, really good. So this year, instead of saying it's bad, let's say it's different, and try to figure out what can we do that's still great and be different. So in our family, here's what we do. So we usually have about 30 people at our Thanksgiving dinner, and this year I think we're going to have like 6 or 7. But my wife's sister's family and some of our very good friends, we were always having Thanksgiving dinner together, and we do this thing where we go through the alphabet, and everybody's got to pick a letter and start with that letter and say, if you get the letter A, tell us something you're grateful for, like apples. I always say apples. I love apples. So that's it. We go all the way around the alphabet, and then we go around the table a couple of times and see everybody gets different letters and blah, blah, blah. So that's a great time. So we can't do that this year. We're not in the same room. But we can do that this year because we may not be in the room, but we can be in the Zoom. That's not bad, right? Room, Zoom. Not
That's
bad.
good.
Not bad for a sleep-deprived old man. So if you could do things, just think about Thanksgiving will be different as opposed to bad, then I think we can still be thankful for our ability to gather, even if it's not the same way. So let's talk about some things you're recommending to the patients or the customers who come through our cafeteria and to our workers to keep everybody safe. Jeff.
Thank you, Steve. Yeah, we have done things differently here within our hospital, obviously, since the beginning of COVID. In our retail areas, we are spacing people out more, and we've got the plexiglass at the registers, and we've removed all of our self-serve food options and the soda fountains. So we've done everything we can here to make our guests as safe as possible. And we continue to take all of the necessary precautions on our patient side to make sure, as we're serving our patients, that we're serving them safely and giving them the best quality food. But as you said, when it comes to that at-home Thanksgiving, it is going to be different, and I think that's just a fact. And we're seeing more and more that these even small family gatherings have the tendency to really cause a potential for spread. So we really have to do things differently. It's keeping those gatherings small. Maybe we'll be lucky and we'll have nice weather on Thanksgiving and we can move some of those celebrations outdoors. But it is keeping that number to a minimum. And when you're thinking about if you do have to have people over and you are having a gathering, even a small gathering, seating people kind of within their own bubbles if they're coming from different households, spreading those chairs out as much as possible. And of course, you guys talk about masks all the time. And if you are bringing people into your home, wearing those masks whenever possible, except when you're eating or drinking. And it feels a little bit awkward and uncomfortable to have somebody come into your house and ask them to wear a mask. But, this year everything's a little bit different and uncomfortable.
It's just different.
It is, yeah.
And I think you could have a Halloween masking contest to see, or Thanksgiving masking, see who can have the coolest Thanksgiving mask. I'll bring mine out. I've already got one that's kind of cool. I didn't make it, in fairness, I saw it. But I'll bring it, and everybody can decide if it's a cool Thanksgiving mask. So talk to us a little bit about, when you see people in restaurants, it's like you walk into a restaurant, and I can take my mask off. But really, isn't it supposed to be just when you're eating, Hawk?
It should be. Just when you're eating or drinking, should you have your mask off. In fact, I was actually walking yesterday and walking on the plaza, and I did see a group of people who had their masks on while they weren't eating or drinking, and they were outside.
Yes.
But definitely inside. And
they've heard you. They've talked to you. They've listened to your messages.
Yeah, they're very intelligent people. But we heard this from our guest yesterday. Was doing everything right, seemingly, but went out to dinner with a couple other friends and couples, and then all of them seemed to come down with it because once they got down to their seat in the restaurant, they took their mask off and had it off for the whole time, not just when they were eating or drinking.
So on your slides, I love that. Be the host with the most, the hostess with the mostest. That's how we say it. And you want, instead of each individual coming through and doing it and then each person's touching all the food and the utensils, you're saying, we'll plate your dinner for you, and everybody has their masks on, then you can go sit down and eat.
Yeah, when we think about a traditional Thanksgiving dinner, if you've got a lot of people, you'll have a big table with all kinds of food, and everybody's walking around helping themselves, or even at a small gathering, passing the trays and platters around, and hey, Uncle Steve, I need the mashed potatoes. And as you're passing that around, everybody's touching that bowl, and everybody's touching those serving utensils, and that really just increases the potential for that risk of spread. So be a great host and plate those plates up so you're minimizing who's touching those utensils and the serving platters. And
I like that.
Make it a little bit different.
A different can be good.
That's
because
right.
Remember, one of our goals for this Thanksgiving should be thankful to be here for the next Thanksgiving.
That's right.
Because things will be better
And then
then.
you raise the bar for next year.
That's so cool. I love it. Okay, so really, if that's left out more than 2 hours, I should throw it away?
Absolutely, yeah. I
Wow,
mean,
that's the number, huh?
That's the number, 2 hours. You don't want to risk getting sick from the food that you
Yeah.
eat. We've got enough risks to our health as it is.
We do.
Yeah, when you leave that food out, 2 hours is really the limit. And,
So my sister-in-law makes these great biscuits. Do I have to throw those out, or can I keep those? Biscuits are okay to leave out.
biscuits are probably okay, but you get into the hot foods or the cold foods.
Yeah.
Those are the ones you want to get back into the refrigerator within that 2 hour time period.
So if I leave the jam on my countertop overnight, I shouldn't try and eat it the next day?
Better safe
No.
than sorry.
Dang, okay. I got to change my life. Bob, what questions do we have out there from folks?
All right. Well, Debbie is asking a question that I think a lot of people are really wanting to know now that we're getting more and more cases coming in. When are you able to go around somebody safely after they've tested positive and have symptoms for COVID?
All right. How long do you have to wait, Hawk, before you can go around? I mean, really, you want that person to be at least 10 days post
Yeah.
being tested, and they have to be afebrile and not having or have marked improvement in symptoms.
Yeah, exactly. We do have good information for this. I know we have a lot of unanswered questions about COVID, but we do have fairly good information about this, even though it's a small amount. All of the data say that really if you have mild to moderate symptoms, you're not critical in the ICU. It's by that 10-day mark after symptom onset. By about 8 or 9 days, you really have reduced the amount of viral load in your infectiousness to other people. Again, you're most infectious 1 to 2 days prior to symptoms to 1 to 2 days after, and it goes down from there. So that's why the CDC guidance is really 10 days after symptoms start, with an improvement in symptoms overall, and and no fever for 3 days. So.
Yeah, so good advice, and you want to stay safe, and you want to
Yeah,
keep
I know.
everybody around you safe.
Sarah is wanting to know, she says, last week, Doc Hawk, that's what she says,
Doc Hawk, that's what I said. That's
I love
good.
it.
Go on, Doc.
Said 5% of positive COVID patients will need critical care. If that's true, how does that compare with influenza patients?
So is it critical care or hospital care?
It's 80 to 85% will never need any medical care. So it's about, it's almost 5% of that 15% even. It's a very small amount, which we have talked about in the past. But how does that compare to influenza? We know that the death rates or the case fatality rates for COVID-19 are anywhere from 10 to 20 times that of influenza. And as we stated before, we've never had more than probably 2 or 3 patients at once in the ICU with influenza, whereas now you can see what we have, 15 with 7 on the ventilator. So
Yeah, it's not even close. And we keep saying this. I mean, I remember in a busy, bad influenza year, we might have 15 or 16 patients or 17 in the hospital.
In the
I think
hospital.
with influenza. And today we have 48 COVID patients in the hospital, and we have another 30 recovering. So that's 78 people here with COVID. That's like so much higher than anything we've ever seen with influenza. It's just not close. And I think people want to make it close so they feel better about it and give themselves permission to go out and not have to wear a mask because it's just influenza. But it's a simple reality. It's just not influenza. And I think we have to understand that. And I know that folks want it to be because they want to be able to live life the way they want to, and they want to feel like, oh, they're exaggerating it, or it's a hoax, or this or that. And I just got to tell you, remember Anil Garmakar being on our program, or the folks we had on yesterday, or another family, or Anthony, one of the folks who works here. I think if you ask them all that, this is not a hoax. It's incredibly real, and it's incredibly different. And influenza is not as transmissible, and it is not as deadly, and it doesn't knock this many people out and put them in the hospital. And it's not to say influenza isn't bad. It's just to say that COVID, it's a whole lot worse.
And the other thing to remember about that is with influenza, probably a majority of those people going on to critical illness, it's more due to a secondary bacterial infection with either Staphylococcus or Streptococcus. It's not just the inflammatory process of COVID-19 in which your lungs fill up with cell-free fluid and fluid that is using because of your immune dysregulation. So there's a lot of different processes there as well.
And we usually have 20 to 40,000 deaths a year from influenza, and sometimes lower than that. But this year we've already had, and we're not even near a year, right? A year will be come April or mid-March or something, and we're well over 200,000 deaths. With the projections, we're going to end up between 500,000 and 1 million. So it's, that's a factor of 10 to 20. So if you want to think about it like that, let's say that COVID is 10 to 20 times worse than influenza. That's probably pretty real.
And I think the best estimate was the mortality rate for influenza, the case fatality rate is 0.05. And for COVID, it's hanging around 0.5 to 1, essentially. So that's
And the case
10 to 20
fatality is
times
how many
more.
people who get the disease die from that disease.
And how many actual infections we know about, because
Yeah.
there are other people who don't get diagnosed and die.
That's
as well,
right.
But
You know,
there's many more who.
In the New England Journal
well.
on October the 29th, I believe, and I think it's a free article, they looked at they did some work in Iceland looking at a population of patients, and they found that 40% of the people who had COVID, based on humoral antibody, never tested positive with a PCR. So if you think about that, that means for everyone we know, at least in Iceland, you probably had another person
Right.
who you never knew had it. And since they didn't know they had it, they could have been spreading it. And so that becomes the underlying issue for us, which is why masking is so darn important.
Kim asks, do you think the hospital will have to go back to stop doing elective surgeries again in order to have enough beds for COVID patients?
Yeah, so Kim, that's a question we're going to be asking, and we're working with elected officials and others this week about that question, and as all of our hospitals in the area. So we'll address that more thoroughly later this week and early next week. I can just tell you right now we still have some capacity, but I think everybody's a little bit more on edge about it. The other thing to remember is that when we had to deal with this before, it was really driven by PPE. We just didn't have enough protective equipment, and we weren't sure about all of our process about how to do it. And so we canceled elective surgeries that included same-day surgeries and things like that. Well, the PPE is not the question this time around, at least not right now. The real question is just bed capacity. So the same-day surgeries doesn't affect you, but the bed capacity, people are usually here 1 to 4 or 5 days. And those are patients, I think the term elective is wrong, because it's not really elective surgery. Those are needed surgeries you're going to delay. So that means we would be delaying people's care, and we really don't want to do that. So we're working hard across our entire community and our entire region to evaluate the number of open beds to see where we are on that. And again, we'll have more to talk about that here toward the end of the week. So just from your standpoint, Jeff, when you look about things, talk about some of how this has affected the cafeteria so much, because I think about ways we've worked to keep folks safe, and when you walk through the cafeteria, the tables are so different.
Yeah, we've made many of the same changes that you see in restaurants around town. Our dining room was closed for a long period of time, and when we were able to reopen it, we removed more than half of the seating in our dining rooms, and so it is very spaced out, and we don't allow more than 2 people for a relatively large table. As I said before, all of our self-service options, the salad bars and the soda fountains where people were able to help themselves, those are all gone. So we're continuing to adjust and make shifts to ensure that we're serving people in a safe manner, that we're keeping our staff safe and our visitors safe, while maintaining that quality of food that everybody needs.
And Hawk, we keep saying it, but the hottest spot in our town is
the hospital.
It's the hospital.
That's
We have 78 COVID patients.
People who are
here.
coming in, are ill.
Yeah, and how many of our staff have gotten sick
None.
from our COVID patients? They get sick out in the community like
Correct.
everybody else, but not
Or-
from our patients.
Yeah, around each other.
And why is that?
Because we have put in place, we understand, for the most part, how this disease is spread. That's in close contact and droplets. And we have adequate PPE, especially the masking and the eye protection, either goggles or face shield. And we do a very good job. We have constant re-education and reminders so that we can keep all of our healthcare workers safe and all the patients safe as well.
I think that's really important, and that's what Jeff has been talking about, the things that you guys have done and the whole hospital has done.
Yep.
Because when we deliver food, that's even a little different process now.
Yeah.
It is. It's making sure that the folks delivering the food have the proper PPE on. As you said, we're continuing to do education and re-education with our staff to make sure that everybody's comfortable with the process and understands what they need to do and why they need to do it.
Debbie is asking, do the doctors think the COVID vaccine will be like the flu vaccine? Will it keep you from getting the virus or just help lighten the symptoms?
Great question.
Yeah, great question.
And I'm thinking it's going to lighten symptoms and help us from getting so sick. I don't know
Yeah.
if it's going to help us prevent it altogether.
That's one of the big questions. So influenza vaccine and the COVID-19 vaccine, influenza, because it's a different structural makeup essentially, it does have the antigenic shift and drift, so it does change year to year. SARS-CoV-2 looks relatively stable, so that's one thing. So hopefully the match of the strain is good, which it should be
because influenza changes every year, so we have to redo the vaccine.
Right.
But the deadly part of SARS-CoV-2 appears to be stable, and if it mutated away, we would be just fine with that anyway.
Yeah, so if it went away, that would be good, because then it wouldn't be able to attach to our receptors and cause infection. So those are some of the big questions about the vaccine that we just don't know the answer to. Once you get the vaccine and you get exposure to the virus, are you going to get infected, or will it stop the infection whatsoever? If you do get infected, is it going to have more mild symptoms compared to if you didn't get the vaccine? We hope so that you don't progress to that severe critical illness. And the other big question is, if you get the vaccine, are you still going to replicate the virus enough to be able to spread it and be infectious to others? And right now, I don't think we know the full answer to those, but those are the three major questions that we are looking for. Again, we hope that you will have more mild disease. That's the whole point of it. Will it protect you against full infection? Probably not, but hopefully it will also protect you against being able to cause spread to others and infecting others as well.
Stephanie asks, I've heard that animal testing is being bypassed in the COVID vaccine trials. Is this true? And if so, what are your thoughts on this?
Yeah, great question. It's not true, actually. Animal testing has been done with the vaccines. The first thing you have to remember is that vaccine development is so much faster in general because we're just so much better at it today than we used to be. And there's some great articles, and again, it's one of the free articles in the New England Journal, but it's interesting because what we've been able to demonstrate is because we can discover the genes and how the genes are we call it genomic sequencing, how the genes are constructed and how they then work inside these viruses so much faster than we used to, like it's comparing light speed to driving your car, then what really happens is we can come up with ways to try and combat that virus a lot faster than we used to. And so that's been a really important development. But in fact, as these vaccines are being tested, while they are at Operation Warp Speed, and while they may come out sooner than we would have in the past, we're trying to do everything we can to keep them as safe as possible. And that's included animal testing, Hawk, and especially in the macaque monkey.
Absolutely. I think the first tidbits of information about some of these vaccines, particularly the mRNA vaccines, were on small studies in the rhesus macaque models. So those were actually the starting places for those, and those were some of the stuff that was initially published, showing that you maybe do have a reduction in the overall viral load, you have a reduction in overall disease severity, or protected fully from disease. But again, those were the initial studies, especially for those mRNA vaccines that I'm aware of.
And in fact, in people, we've looked at 30 or 40,000 people with the vaccine, so it's not a small number.
Right.
And what you want to do in those trials is find the side effects to make sure that they are safe. In fact, a couple of those vaccine trials got temporarily halted because there are patients with difficult outcomes, and they weren't sure if it was due to the vaccine or not. So then they have to do a lot of studies on that. So were they in the placebo arm? They were in the vaccine arm? What had happened? What's the incidence of that complication? So, for example, it was reported that there was a patient with what's called transverse myelitis in the spinal cord, or two people, I think, in England on one of the vaccines. Transverse myelitis means that you have inflammation that goes into your spine and can actually transect your spine, meaning that your nerve impulses can't pass anymore. Now, oftentimes after a result of a viral, that could leave a permanent deficit, or you could have recovery. And so what we've been watching is to see if those patients got better, and also whether that's just something that happens with SARS-CoV-2, which I think is where it's going to land because that trial's been restarted again.
Yeah, and I think there was also a patient in Brazil that they had paused the trial for. But I had thought that and I wasn't able to read it, but just kind of heard in some of the podcasts that patient actually got placebo, didn't even get the vaccine themselves. So, need to be fact checked on that, but that's what I thought happened during that patient. I think that's what I recall too.
So.
All right, we always get a what-if question every day.
Okay.
Deb has today's. She wants to know, what are your thoughts on someone who's positive for COVID sitting 6 feet from someone, both wearing surgical masks, for 8 hours? What are the chances the non-infected person could contract the virus?
Oh, that's a great question. And that's a really good, and certainly something that we'd have to consider plausible. So,
yeah, absolutely. I think low risk, but no risk. I think it also depends when was that person tested positive. Again, we said you're probably having the highest viral titers and most infectious 1 to 2 days prior to symptoms to 1 to 2 days after that. After that, it decreases. If you're just sitting breathing as opposed to yelling or laughing or doing any other exertion, again, I think it's lower risk. It's not no risk, however. And it's probably as safe as it could be, but that is a large amount of time as well.
Yeah, so the other thing is inside, outside, or if you're inside, what the room's like, how low the ceiling is, where your secretions are going, there's ventilation on the floor up above you, and all those things change our dynamic a lot, and I think that it's hard to know, but there's an increased risk from that.
Yeah.
And you know, so should that person who is in that, do you think they should quarantine, or do you think they're safe to not quarantine?
You know, I think...
and that's a hard question.
Yeah,
Sure
because the
answer.
definition would be if you're 6 feet for 10 minutes or more, or 10 or 15 minutes, you're an exposure. It doesn't matter if either party have masks on or not. So if you're outside of that 6 feet for 8 hours, you know, would you consider yourself not exposure? I mean, we know that there's a clinical efficiency with which this virus spreads, and nothing is 100%. So I think that's just based on the time, that's pretty high risk. But we understand Anil, who had one of his family members sitting on the other side of the couch when he was extremely ill, and they didn't get sick. So I think you would still have to go about your life as you are probably an exposure at that point, but your individual risk is probably much less than if you didn't do those things.
And masks do clearly help. And
Yes.
we've shown that in the freezer. Among
Yeah,
other places.
absolutely.
So, all right. Next question.
All right. Sarah says, or is asking, there have been reports of outbreaks linked to ice rinks in the Northeast and hockey teams. Is it safe to do ice skating lessons at indoor rinks right now? Does the cold and ice keep the virus in the air longer?
Oh, great. That's a man. We got the questions coming in today.
I know.
So I've not heard about the ice skating rinks in the Northeast, but that wouldn't surprise me. I mean, clearly we're seeing it with basketball and football and baseball and other sports. So I think anything indoor soccer, it's all going to be the same. And just to say, I don't think the cold and the ice are going to stop the virus.
Yeah, I don't think the temperature is going to have anything to do with that in this case. I would suspect if everything, and you've done things safe prior to going to these individual ice skating lessons, that is safe. I did see, the published report. There's a very good one about an ice hockey team in June in Florida, in which there were a number of cases, but I'm not aware of the other cases in the Northeast. But you have to also think that if all of those groups and those teams are together in the locker rooms, if they're exerting themselves, that it's probably going to be pretty easy for that virus to spread because you probably are not wearing masks during those times as well.
I think the locker room is a big source of concern.
Yeah.
It may not be just the time on the ice.
Right.
But to the question, are you safe to take ice skating lessons? I think it's totally about what the rink is like when you go in. How long? I mean, if you're walking right in on the heels of another team playing, a bunch of people are out crowded the arena, or there's a lot of other kids taking ice skating lessons, the simple answer is, yeah, it's probably not as safe. If you're the only person on the ice and there's been a little bit of time elapsed before the next team goes in, I don't know what the number is, 5, 10, 15 minutes, but let's say that the rink is cleared out and you go in and you're the only one on the rink with the coach and getting them both to wear a mask, I think you're pretty safe.
Yeah,
so I think it really depends on it's such a dynamic question, and we don't try and sidestep this stuff. We try and answer it as best we can to the best of our ability. But sometimes the questions, there's a very dynamic environment about whether it's safe or not safe, and we try to do our best.
All right. Donna says it's great that none of your staff have gotten ill from patients in the hospital. She's wondering, though, how many have gotten ill from exposure in the community, and how's this affecting your staffing?
Oh, man.
Great question.
Who wrote all these questions? Who wrote all these people in today?
Intelligent viewers.
My
Intelligent
goodness.
viewers.
I think they all got tired of CNN or Fox, and they're watching us today because we're not talking about the election. So, you know what? I think that's a great question, and that's something we'll show. I think tomorrow's our day today, and I think David will be down here. I'll be up doing some other work tomorrow, and we'll have some information for you. But we have had a number of staff get sick, and it's really been from the community. Or we think sometimes when people eat lunch in break rooms, Jeff, I mean, that's been a concern. So talk to us a little bit about what are we saying to our employees about what are the do's and don'ts of working in the hospital, even if you're not inside the cafeteria?
Yeah, it is a challenge when we've got a lot of people that are taking lunch at the same time or taking breaks at the same time. And historically, people will congregate in break rooms or other places. And we've really done our best to discourage that and work with our departments to spread those breaks out so everybody's not taking that break at the same time or taking that meal at the same time, because that is definitely a high exposure area. Really focusing again on mask compliance, even when people are congregating in a break room, maintaining that 6 feet. And, Dana, as you said, it's wearing that mask when you're not eating or drinking and not letting your guard down because you're no longer in that patient care area.
I think that's the key. It does affect us, to be honest. Let's just answer that part directly. And we've had times where we've had a number of staff out with both being positive and with having to be on quarantine. We think that our rate of infection over the last 8 months, compared to what we believe the community rate is, we are about half of the community rate in terms of like a total percent of our population. If you think we have 13,500 people on our campus and are close to that number, then I don't remember, and I don't want to misstate it right now, but our total number of infection rates is lower than what we think the total community infection rate is. Now, that last statement is a bit of a guess, because we don't really know. We do know what our staff rate is, at least based upon the number of positive people we've had. And it could be higher, obviously, because people may not be asymptomatic and have been positive, but that same statement's true for the community. So if you just look at the positivity rate, we're lower than the community, but we still have a lot of folks doing it who do get sick, and it does affect, it affects lots of services here before.
It does. It can be anywhere from a clinical area to a phone call center. So it's something we watch very carefully, and we stress the symptom monitoring every day and trying to identify those cases as early as possible so we don't continue to spread within our hospital community.
Debbie says, we change our clothes whenever we've been away from home. Is this still necessary, or does it just make me feel better? It's beginning to feel quite aggravating.
So it's no longer making you feel better now, it just makes you feel bad. So, Hawk, I don't change my clothes. What do you do?
No, even when I'm working on the COVID units, I don't just get home and take off my clothes and change into other clothes. I think it's probably more aggravating to you. I don't suspect you really need to continue to do that practice.
So what about your colleagues? What's some of the other guys doing in your division?
We've heard of other things where people would, either wear street clothes here and then change into hospital approved scrubs
stuff,
and then change out and go back home with that. There was just a wide variety of practice. Some people would undress in the garage before they got in to go see their family and would have new clothes out there. I don't know what they're doing now. I think all that's probably tempered down quite a bit as we've become more used to what's going on and have our other systems and protocols in place here at work.
I think it also means that we believe that the real spread here is it's airborne.
Yes.
The surface stuff, yes, wash your hands. Don't stop doing that. We don't mean that, especially in the cold and flu season, because lots of other stuff are spread that way. But I think SARS-CoV-2. I think it's all about the airborne nature of it.
Yeah, absolutely.
All right, Kathy asks, do you think there's much risk in letting my 3-year-old grandchild stay over?
Wow, I tell you, that's all about what that 3-year-old grandchild's doing and what the bubble's like for that person, that grandchild, when they're not with you, and what your health is like. So is there increased risk? Of course there is. We can't ignore that. It just is. That's the age of COVID. Is that risk worth having them stay over so you can be with your grandchild? That is a personal decision that only you can answer. Remember that 3-year-olds are often asymptomatic with the disease. You may not know it. If that child's in a really safe bubble with parents and doesn't play a lot with other kids and things like that, then it lowers the risk. But if that kid's with other kids, there's a risk that they're going to have it. And one other way to try and make it safer is for that child to perhaps have been not play with anybody, but stay in his own bubble for a week or 10 days before he comes over to spend the night with you or spend a couple nights with you. But that's probably the only way you can really reduce the risk, is if that grandchild is able to quarantine before they get to you. But the truth is there is risk, and I don't think we can remove that risk. And so then it just becomes a question of your personal level of risk aversion. Like, are you willing to take on? Are you really healthy? You think, I'm going to be fine, and it's worth it to me to see my grandson or grandchild? Then okay, that's what you're going to do. But if it's not, or if you have underlying chronic heart disease or lung disease or cancer or things like that, then I think it's a little riskier, Hawk.
Yeah, no, I agree with everything you said.
See, every now and then we're on the same page. Watch out for that one.
Lots of times.
Cindy
Most
said,
of the time.
sorry. Cindy asks, an article in Scientific American says a study out of the Netherlands shows getting a flu shot might reduce coronavirus infections. Can a vaccine designed to present against one infection protect against others too.
Yeah, that's interesting. There's a lot of
Yeah.
stuff circulating around about that about a month or two ago. It may help modulate your immune system a little bit.
Yeah, I think those are actually trials that are actively being looked at with different types of vaccines. There is the thought, just like you said, there is some immune modulation going on. I don't believe that it will necessarily have any real significant or beneficial effect. We know that the flu vaccine will protect you from missed days at work from influenza and some other cough and cold viruses, severe illness from influenza. So definitely get your influenza vaccine. But how much will it protect you and significantly affect you with COVID-19? I think that remains to be seen. But those are active, ongoing trials right now.
Erica says, can you talk more about the disease progression in asymptomatic positive people? Will they experience lung damage or other long-term health effects?
Oh man, another great
Golly.
question. These are really good. So, that's a great question. What we do know is in kids and now in adults with that inflammatory response, that inflammatory syndrome that occurs sometimes 10 to 14 days out, and sometimes even more, that happens with both asymptomatic and symptomatic patients. So the answer is you can get some of the long haul problems, not as frequently as the people who are symptomatic from the beginning.
Yeah, and I think it's the real key is asymptomatic. Did you really have any symptoms at all? We know from asymptomatic people that have been followed in very good trials, especially in Korea, where they were able to put people into these COVID treatment centers and really watch them for 14 or 21 days. So they knew they were totally asymptomatic. But they have also changes in their lungs based on CT scan. So it remains to be seen, can you still get those problems, those issues, some of the other long hauler problems? Probably to some extent, but most likely not as intense as, say, somebody who does have moderate symptoms or has had critical illness.
I think a lot of the kids with the inflammatory thing, they were asymptomatic and then came in later.
Yeah,
and I think we're seeing that in some young adults too. So I think the answer to that question is yes, not as frequently, hopefully not as severe.
Yeah.
Lots to answer around that point though. One more question.
All right. Mike asks, how long does the virus live on a surface? Any idea?
Yeah, Hawk, we do.
Yeah, there's been some pretty good, very well done laboratory experiments, so it's very controlled conditions. And it showed different things from hours to a couple days, but what is the real significance of that? What are the concentrations? Certainly we know that there will be viral decay once it does get outside of the body and does land on the surfaces. We know that it can be for hours on the human skin based on a small study, but that luckily, the alcohol gel or the alcohol hand sanitizer can neutralize that and kill that within about 15 seconds. So we know it can be hours to days in some of these experiments. But what is the significance? Because again, we know that the virus will start decaying. We know that the concentration of the virus will start going down. It could cause infection if you came by, say within 10 or 15 minutes of somebody who was just coughing or had sneezed on that surface and you touch it and then touch your mucous membranes. But again, it's probably not significant as far as a large number of infections. That's why hand hygiene is so important.
All right. And I know, Jeff, your team, hand hygiene, I watched it down in the cafeteria. It's been outstanding. You guys work hard at it.
Yep, absolutely.
So, hey, tomorrow a deadline is fast approaching for nursing homes to enroll in a virtual, nationwide, interactive training program to keep seniors safe. KUMed has been awarded a grant and is leading the nation with our best practices. Dr. Shauna Wright, a licensed psychologist, is the principal investigator for KU Medical Center on this grant. She'll be joined by Dr. Jessica Callender-Rich, a national member of the Coronavirus Commission for Safety and Quality, and one of our geriatricians. She's been with us before. She's the one that coined the phrase, for us at least, treating COVID is kind of like building an airplane while you fly it, because you're trying all these different parts out and you hope some of them fit. So I think it'll be a great discussion. I think you'll hear a little bit more about what the status is of nursing homes around the community. I was on a call today where there was one in one area of Kansas where there were 65 nursing home residents and 45 have tested positive. And so that's a recent development. And so we continue to watch nursing homes because we know that's an incredible, vulnerable population. So I think that, and listening to this, this important grant for best practices about how to keep nursing homes safe for seniors is really an important discussion. David Wild will be here. I'll be out tomorrow. Hawkeye will be here, and they're going to be running the numbers again. So, Jeff, final thoughts from you today.
You know, I think it's just about recognizing and understanding that things are different right now, and things are going to be. And as we get into the holiday season, I think it's a time when everybody wants to break from this pattern and be with family and friends, and we're going to have to just continue to be vigilant and patient with this so we get through it safely.
Yeah, thank you. And thanks for coming down today, Jeff, Kevin, whoever. I don't know why I did it. And being with us, we so appreciate your being here. Appreciate the great work of you and your team to help keep our patients, keep our hospitals safe, our visitors safe, and our staff safe. Hawk?
I think Jeff said everything very well. Really nothing to add. You know, the virus continues to be out there. We continue to do all the things that he talked about and really try to keep everybody safe as possible, reduce the infections, reduce hospitalizations, and especially death, especially moving into the holiday season.
And as you grapple with the results of a national presidential election, remember, the rules of infection control travel with you wherever you go, even right there. And eventually, they're going to answer that question. You know what? We're going to be okay. And on the COVID crisis, we'll be okay. But the one that can change it is you. And the way you change it is by following the rules of infection control. We tell you this every day. We're telling it to you again today. Wear a mask, keep your distance, cough into your elbow, stay home if you're sick. Take care of yourself. Give yourself the grace to be a little less than you would normally be in the height of this crisis. In the meantime, there's still no place like home. We're back tomorrow.